I'm Dr. Jason Portnof. I'm an oral maxillofacial surgeon in Boca Raton, Florida. I'm the 2026 scientific chair for the Florida Dental Convention, and I'm honored tonight to have Dr. Kevin Suzuki here with us to talk about the programs that he's going to be presenting, the mini residency that he's going to be providing for us at the Florida Dental Convention this year. And I'm really excited to have Dr. Suzuki here, and this is going to be awesome. So the course topics that we have for this summer is going to be basic and advanced suturing, hands-on workshop, bone augmentation in preparation for dental implants, a 2-day mini residency, and clinical crown lengthening hands-on workshop, which are going to be awesome, very cool hands-on programs that we're all going to be excited to participate in. And so right now I just would like to welcome Dr. Suzuki and let him, even though he needs no introduction, I'd like to introduce him, and let him kind of talk to us about himself. So Dr. Suzuki, why don't you tell a little about yourself and your background?
Thank you very much, Dr. Portnof. It's really exciting to be back at the Florida Dental Association again. It's been a couple of years since before COVID. I'm really excited to be part of the program again. I originally am a periodontist by training. I went to dental school at Nova Southeastern, Florida in Fort Lauderdale, so it's exciting to be back in Florida again. I went to periodontal residency at Temple University in Philadelphia. I graduated in 2010. Since then, I've been working in private practice here in Seattle, Washington. I'm a partner surgeon or part owner at a 7-surgeon multi-center practice. I've also done a lot of additional training in implantology and periodontal surgeries, and I teach at some institutes around the country. There's one down in Dallas that I work with called the Institute for Dental Advancement. We do live hands-on implant placement, glove on glove with other dentists looking to learn surgery. And then I also worked for a time as a faculty member of the Mish Implant Institute, and now called the Resnick Institute. So I'm still an active faculty with them as well. So I'm very much hands-on with both private practice and with teaching these topics.
That's awesome. So, I mean, we're excited to have you again, and welcome back to Florida. It's been a while. I don't know if you've visited here, but it's basically the same. We still got sun and we got palm trees, and just like it was when you were in dental school. And but you're in Washington State, Seattle, correct?
Yes, that's correct.
Yes.
I work in a couple practices here. One's in Federal Way, and the other one's in downtown Seattle.
Awesome. So maybe you could tell us a little bit about the programs that you're going to provide or offer at our convention. The mini residency in particular, it's going to focus on bone augmentation for dental implants. So just maybe you can give a little brief summary about that.
Yeah, that's actually my kind of primary reason I was originally invited to come down. It was a 2-day program I was going to give that was fairly intensive. It's going to be a combination of some lecture, some demonstration, and of course, hands-on desktop work with both typodonts and with practicing tissue management with pig jaw specimens. So we'll talk a lot about basic principles and indications for bone augmentation, the various materials, membranes, and suture types. We'll talk about flap management, different types of defects, and kind of when to implement some of these techniques. I would call it anywhere from basic to moderate or intermediate grafting techniques, because we'll talk about some bulk grafting indications as well. And we'll even do a little bit of autogenous harvesting that are fairly simple techniques to do with some of the great instruments and technology now. So, I'd say anywhere from treatment planning the grafting to implementing it, also post-operative management and care. So I think that's kind of everything people need that are looking to just kind of get their feet wet and start with grafting. And also if you're looking for a little bit more intermediate level skills as well.
That's awesome. It's gonna be great. And then, we talked about, basically the treatment planning and one thing I want to ask you about is like, what do you see in store for the future of implant dentistry with the growth in digital dentistry, and how can, dentists apply that into their practice?
Sure. With digital dentistry, we're already seeing now, some of the technology, of course, to treatment plan the case, treatment plan the orientation. There's great softwares and programs that can anticipate if you don't have enough bone bulk or volume or dimension in an area. They can anticipate how much graft you may need and, where it's indicated. I think there's research coming down the line eventually with maybe even 3D digital printing with bone augmentation materials or even blocks of bone that, I think some companies are starting to research. So that's really exciting. And I know there's even been some articles and research, some of our Asian counterparts that are looking into eventually automated implant placement. So I don't know if that's something to implement in the immediate future, and hopefully not too soon for us dental surgeons, but those are some of the things that I've seen emerging in the literature as of late.
So, one thing that a lot of the dentists that, participants in these courses, especially if they're just starting to get involved with implants and bone grafting and surgical aspects of dentistry, they're worried about, getting into trouble or, complications and like, they want to be able to prevent it from ever happening. They're worried about it. So, what do you think is some of the most pressing issues and maybe common complications that people might encounter in oral surgery and periodontics and perio surgery and like how can they avoid them? And maybe you'll go into deeper into that in the courses.
Sure.
But maybe just a couple of key bullet points for us.
Yeah, it's a couple of things. One would be, kind of recognizing and implementing the skills and also knowing their limitations. So, case selection is one of the big things we always learned about with all of our other aspects of dentistry. That's, just as true, if not more so, with dental implants and bone grafting, knowing which cases you can take on and maybe which ones are a little bit more advanced. One of my mentors, Professor Carl Misch, always said that it's better to see the back of a patient's head once than the front of their face if they're angry that something didn't turn out over and over again in your practice. So, case selection is everything, knowing which ones you can take on and what you're capable with, what the skills will teach you. So
Yeah,
that's one
definitely.
aspect. I guess one other thing to consider would be, when you do have complications, one of the most common things I'm seeing that we get referrals for are implants that were attempted or placed without having the appropriately grafted or developed site. So, trying to get by with just barely enough bone or just barely enough soft tissue when there's already defects there. I'll try to touch on that quite a bit in my course as well, and developing the site from a primary ideal standpoint first, and then placing the implant in an ideal situation.
Yeah, there's so many nuances. It's not always just a slam dunk. You can throw the implant into bone because there's bone there. Sometimes or most of the time, there's a lot more to it. So that's brings me to my next question, which is there's so many exciting things. New developments and technologies and things like that. So, what's the last case that you can think of in your mind that sparked excitement? That was really something interesting to you, or alternatively, what was a complication that you were encountered that you were able to resolve and overcome? Anything that you kind of give us some tidbits.
Yeah, sure. An interesting things is some of the grafting techniques with bears and membranes I'll teach in the course are things I use every day. So, even just before the holiday, 2 weeks ago, I get referrals very routinely for implants that are ailing and failing. And some of those require what we call salvage surgery or augmentation, exploratory flap surgery, where you're actually grafting around implants and trying to decontaminate them and build the bone back. And so, some of the flap surgery we'll learn about, you can utilize some of these bone grafting techniques theoretically in cases for implant salvage and repair. And so, I think that's something that's really exciting, and that's something I do on a regular basis every week. So.
That's awesome. We're definitely excited to hear all about that because we see it in our practices all the time, and it's great to have some options of what to do. So all right, so now these are great pearls and just kind of whetting our appetite for what we're going to see at the course. But what are some of the biggest takeaways a dentist will get from your courses at the FDC? Why should they attend? I mean, I already could tell you why everybody should attend because these are going to be awesome. But what do you think? What are some of the takeaways?
Yeah, so I'd say the takeaway messages are, we kind of touched a little bit on case selection, knowing which cases would be appropriate for private practice for most general practitioners wanting to learn surgery, the various types of materials that can be used, which type of defects require certain combinations of graft material. And then also, I'm really excited too. A lot of dentists, after the courses tell me they really appreciate getting experience with various suturing techniques and also flap management, because I can't state enough how important those are. If you can manage the flap and the suturing well, you get a more successful result. So I would say those are kind of the big things with the courses.
Awesome. That's gonna be great. I'm so excited. Thank you so much for your time and speaking to us tonight. And we can't wait to see you this summer. It's gonna be awesome. Very cool.
I appreciate it. I'm really looking forward to being back.
Thank you.